Hello, everyone. I'm Molly French with the Alzheimer's Association. We will be starting the workshop in just a minute, so hold tight. Thank you so much for joining. And if you're just joining us, thank you, welcome. We're gonna let a few more people log on, and then we'll get started in just about a half minute. So thank you so much for joining us. And I think we'll go ahead and get started. So thank you to everyone who joined today. Really want to welcome and thank you so much for being part of our interactive workshop on implementation of curriculum resources for a public health approach to Alzheimer's and other dementias. I am Molly French. I direct the Healthy Brain Initiative for the Alzheimer's Association. And we're really excited to have you here. This is a regular Zoom meeting, so if you haven't unmuted yourself, please do so. And we have a really special honor today. I'm thrilled to have Dean Fried from the Columbia University Mailman School of Public Health join us. So Dean Fried has devoted her career to advancing the science and knowledge and practice of healthy aging, particularly through her work on the prevention of frailty, cognitive decline, and disability. She's done so much to advance public health work in this space, and she's going to welcome, thank you so much, Dean Fried, and want to ask if you'd provide us just with some introductory remarks.
Well, I'm delighted to, Molly. Thank you, and I'm particularly delighted to welcome all of you to this very important session. I'd like to maybe think in a big picture way to try and introduce the importance of what's going to be discussed today. We are undergoing a demographic revolution. Soon, older adults will comprise 20% of the US population, and by 2050, it's estimated that 1 in 4 adults in the US will be over 65 years of age. In many countries around the world, older adults already comprise 1 in 3 of all the people in the population. And this year in the US, this is the year we have as many older adults as children for the first time in history. Gains in life expectancy have not occurred evenly across various racial, ethnic, and demographic groups. However, we now know that public health approaches to make the opportunity for health the default option for everyone will not only help resolve health disparities, but also will increase both life expectancy and health span for all. And we now know that prevention works and matters at every age of life. We didn't know that 30 years ago. And we have evidence emerging from what I could call natural experiments in the US that show that people who benefit from such health promoting conditions across their lives and into the oldest ages, in fact, have health spans that come close to their longer life expectancies. These groups with longer health spans have benefited from more education, less poverty, more public health, and better medical care than others. This could be generalized to everyone. Health challenges, we know, increase with age as a result of both accumulated risks over a lifetime and aging-specific effects. In particular, for this session, major chronic diseases are a concern, with 80% of older adults living with at least one chronic disease and 50% with at least 2. As more and more people age, rates of physical and cognitive disability, chronic disease, and comorbidities are anticipated to rise, increasing the complexity and cost of delivering or receiving care and really necessitating that we rethink the services, care, and health promotion that we provide. Public health has key roles to play in designing and delivering primary, secondary, and tertiary prevention and the science to underpin this so that we build health and health span for everyone. Alzheimer's disease is, of course, one of the major health concerns associated with getting older, especially late older age. In the US, 5.8 million people carry a presumptive diagnosis of Alzheimer's disease, and this is estimated to rise in the next 30 years to 13 to 16 million people. Globally, the prevalence of Alzheimer's disease is 34 million people and is expected to triple to 100 million people in 2050. At that time, 1 in 85 people in the world will be living with the disease. Alzheimer's disease needs public health leadership for understanding the needs and challenges, the risks and outcomes, the opportunities for primary, secondary, and tertiary prevention, and the programs to deliver it. The interventional opportunities are broad, and I'll give you a few examples. First, data from Ron Brookmeyer said a few years ago, reported that if preventive interventions could delay both Alzheimer's disease onset and progression by just 1 year, there would be nearly 9.2 million fewer cases of Alzheimer's disease in 2050, with a major decline in the numbers of people needing a high level of care. Second, a life course approach to prevention and health promotion is the key investment. According to Barnes and Yaffe a few years ago, half of all cases of Alzheimer's disease could be attributed to 7 potentially modifiable risk factors, which will sound familiar to this audience: diabetes, midlife hypertension, midlife obesity, depression, physical inactivity, smoking, low educational attainment, and/or cognitive inactivity. Physical inactivity is a particularly important player. A 10 to 25% reduction in all 7 risk factors could potentially prevent as many as 3 million cases worldwide and 500,000 in the US. Attention to stroke prevention is a current opportunity we already know about to decrease the onset and severity of Alzheimer's disease. A third example is Experience Corps, the first community-based intervention to effectively slow cognitive decline. Experience Corps is a novel model of a public health program to prevent cognitive and physical decline, frailty, and disability hidden in a senior volunteer program in which older adults serve to assure the success of children in public schools. Fourth, and finally, some estimates are that 43% of prevalent Alzheimer's disease cases need a high level of care, equivalent to a nursing home level of care. Public health and clinical science show that people who already have Alzheimer's disease also need prevention of potential associated conditions, and their caregivers need support and prevention. The public health system has a potentially critically important place in programs for people who already have Alzheimer's disease, as well as in primary and secondary prevention. These can range from designing and delivering community-based approaches to supporting the well-being of those with Alzheimer's disease and their caregivers, from health department roles and roles for community health workers and volunteers to systems that identify those at risk in an emergency, to even considering new community-based models for long-term care. Overall, the creation of geriatrically knowledgeable and integrated public health, medical, and social care systems has the potential to amplify capabilities and well-being while supporting needs at the end of life. I want to end with just 2 comments. One alert for all of us. One of the pitfalls of starting with thinking about aging from the point of view of Alzheimer's disease is that because of ageism, we conflate our attitudes toward older people with a picture of people with dementia. And as long as we do that and think that that is the sole picture of aging, we do not invest in a belief in prevention or the role of public health. That conflation is not what the data say. And so hence the picture I'm trying to paint. And I will say that If we add public health to our demographic transition, we have the potential to actually transform our future, because we are investing in the creation of healthy longevity, which will unlock the potential of the longer lives we wanted by investing in childhood prevention, preventing women from dying in childbirth, preventing infectious diseases and occupational injuries, etc. The opportunities of longer lives are what we wanted, and investing in what we need at the ends of our lives, as well as developing healthy longevity for its opportunities, is critical. Thank you.
Thank you so much, Dean Freed. We know you have a busy day, but I just really appreciate, the wisdom and the insights that you've provided in terms of taking that life course approach, remembering that older adults can contribute through the experience core, and how much we need public health to continue investing in healthy longevity. So thank you. We're just very honored to have you with us today.
My pleasure. Thank you for doing what you're doing.
Yes, thank you. All right, and I wanted to thank, let's see, excuse me, while I get this, I'm not sure how I kicked us out of the, there we go. Thank you. If you are just joining us, I'm Molly French with the Alzheimer's Association. I want to thank ASPPH for hosting this workshop. We've been very excited about it, and thank you to everyone who's joined. You saw our presenters with Heidi Holt with the public health, who's a public health advisor with CDC. And my slides got out of order there. And also want to thank CDC for the support for the curriculum. They've been a wonderful partner for us through the years. And also another key partner on the curriculum has been Emory Centers for Training and Technical Assistance with the Rollins School of Public Health. And Taylor Kennedy, who is a community education engagement coordinator, will be presenting, and Kaylee Jones will be facilitating one of the breakout rooms with me, and Kaylee is a health communications coordinator. So just a couple quick housekeeping items, and that is one, if you do have questions, comments at any time, please use the chat function, which should be at the bottom of your screen. We are recording the workshop so that can be available to others afterwards. And we will be sharing the recording link as well as slides and a document with short responses to your questions and comments as appropriate after the event. So what does today look like? We've already had the benefit of Dean Freed and her introductory comments. Heidi Holt will provide a curriculum, a little bit more background about Alzheimer's as a public health issue and the origins of the curriculum. Taylor Kennedy from Emory Centers will give you a quick run through the main components of the curriculum and some creative ways that it has and can be used. And then we're going to have 15-20 minutes for breakout sessions where each of you, all of our participants, will have an opportunity to talk with each other about how you've adapted and potentially used the curriculum or could be planning to use the curriculum in your online or in-person classes. And depending on your situation, we'll wrap up with Q&A and get you out of here at the promised time, 3:30 Eastern or whatever the equivalent is in your time zone. Oh, didn't mean to do that again. So there we go. You have seen the learning objectives when you registered. And with that, I will turn it over to Heidi Holt with an overview about Alzheimer's, a public health issue. Heidi. Oh, and Heidi, you might be muted yet.
I'm sorry, too many buttons to enable, and I very much appreciate that introduction. Thank you very much. So my name is Heidi Holt. I am with the Centers for Disease Control and Prevention, and I am looking for the slides. Apologize for that. So I work in the Alzheimer's disease and healthy aging program, work as in strategic planning for the branch, and work with state programs as well as public health professionals. And I'm going to discuss a little bit about the background of public health and CDC's role in that. And Dr. Fried already told us a little bit about this information, but I'll go over it just again so there's a visual. By 2050, the number of people ages 65 and older with Alzheimer's disease or other dementias is projected to be about 13.8 million people. Barring the development of a medical breakthrough to slow or cure the disease. So with the aging population, this number is going to continue to rise and escalate. And the costs for caring for those individuals with this disease will also expand. In 2020, caring for people with Alzheimer's disease and other dementias cost society an estimated $305 billion, including $206 billion by the government. That includes Medicare and Medicaid in the dark green bars. In 2050, costs to society will total more than $1.1 trillion, with the cost to Medicare and Medicaid totaling a combined $777 billion. And that's just in today's dollars before inflation. So not only does Alzheimer's strain the healthcare system and the economy, it also places high levels of burden on family caregivers who provide roughly $234 billion in unpaid care annually. So Alzheimer's disease, surprisingly for many, is of the leading causes of death for those age 65 and older. It is number 5, which puts it above diabetes and closely behind cerebrovascular diseases such as stroke. African Americans are at 2 times greater risk, and Hispanics are at 1.5 times greater risk. Again, Dr. Fried mentioned a little bit about the modifiable risk factors that are on the screen. And public health has strengths and capacities to advance awareness about the interplay between brain health and physical health by linking dementia and cognitive decline risk messaging to other health promotion activities in areas that exist already and those that are here on the screen. Sharing accurate information, including blending messages about this interplay, using culturally aware messaging, can really reduce the risk of cognitive decline and improve overall health and well-being. So this slide is a little bit more complicated, but it shows the prevalence of each of the 8 chronic conditions that were examined by a recent study that CDC did using behavioral risk factor surveillance system data on subjective cognitive decline, and SCD. SCD is the self-reported experience of the worsening or more frequent symptoms of confusion or memory loss, and is one of the earliest signs of Alzheimer's disease or other related dementias. The left column shows the prevalence of the disease without SCD, and the right column shows the prevalence of those with SCD. For all 8 of the chronic diseases examined, the prevalence was significantly higher in those with subjective cognitive decline compared to those without. And I want to make a note that these numbers are for adults 45 to 64 years old, and prevalence estimates for both groups are much higher for those who are over 65. So public health, why public health? So public health can really increase awareness about the connection between brain health and physical health by linking dementia and cognitive decline risk messaging to other health promotion activities. As we see here, the dementia continuum spans decades, providing many opportunities to change the outcomes across communities. Just as with other chronic and degenerative conditions, public health can work to reduce the risk in populations, further early detection and diagnosis, and improve the safety and quality of care for people living with cognitive impairment, as well as attending to caregivers' health and well-being. So the curriculum we're telling you about has its origins in the Healthy Brain Initiative, which started in 2005 when the CDC and the Alzheimer's Association came together to recognize that Alzheimer's disease is a multi-layered, complex public health challenge that is rapidly growing. The initiative seeks to make Alzheimer's disease and other dementias a central part of public health practice, because in the public health, the US traditionally has not seen dementia as part of their purview. To provide public health professionals with a library of evidence-informed information and actions, the CDC and the Alzheimer's Association, along with a long list of partners, developed these roadmap series of documents and implementation materials. The Healthy Brain Initiative roadmaps, for example, has 25 actions a public health community can do over the next 5 years. These actions are organized into 4 domains of the essential services of public health: monitor and evaluate, educate and empower, develop policy and mobilize partnerships, and ensure a competent workforce. So one action in both of the roadmaps is educating the public health workforce. So we worked with the Alzheimer's Association and Emory to create this wonderful curriculum. So the public health approach to Alzheimer's and other dementias. It's a competency-based curriculum developed by the Emory Centers for Training and Technical Assistance at Emory's Rollins School of Public Health and the Alzheimer's Association and CDC. An expert advisory group provided input at each step. In support of the HBI Roadmap's workforce domain, the curriculum is designed to increase understanding of Alzheimer's disease and other dementias as important public health issues, and help faculty prepare students for careers in which they need to apply public health approaches to address Alzheimer's disease as a multi-layered, growing public health challenge. Originally created for use by undergraduate public health students, this introductory curriculum has a much broader applicability to master's level students, related disciplines such as social work, physical therapy, and nursing, as well as practicing public health professionals, to utilize as an introductory educational resource. So this is my contact information, and anytime you have any questions at all, and I will go ahead and turn this over to Taylor.
All right, thank you, Heidi. Hi, everyone. My name is Taylor Kennedy, and I'm the Community Engagement Coordinator at the Emory Centers for Training and Technical Assistance at the Rollins School of Public Health at Emory University. And today I'd like to provide you with some more information about the curriculum and key features. There we go. First, I'd like to give you an overview of the curriculum content. The curriculum is comprised of 4 modules, which provide an introduction to Alzheimer's and other dementias as a public health crisis, the basics of Alzheimer's, the role of public health in addressing the epidemic, and an understanding of dementia-capable systems and dementia-friendly communities. And the 4 modules were designed for use either as a set or as standalone modules. So Module 1 focuses on framing Alzheimer's disease and other dementias as a public health epidemic at the national, state, and local level, while Module 2 provides background information on Alzheimer's disease and other dementias. So next we have Module 3, which discusses 4 public health intervention tools that may play significant roles in mitigating the Alzheimer's crisis, and Module 4, which addresses the public health response to the Alzheimer's disease epidemic at the state and community levels. So this curriculum is peer-reviewed and competency-based, and it can be used in a number of interactive ways and in various settings. The 4 modules were designed for use either as a set or as standalone modules, and users are free to make changes to the materials to fit their needs, including adding, modifying, or removing graphics, talking points, discussion questions, or other learning activities. And another important note is that the curriculum is free to access. And while this curriculum was originally created for undergraduate students of public health, it can also be used as an introductory curricular resource for graduate public health students, public health professionals, and students in related disciplines such as social work, gerontology, nursing, physical therapy, as well as occupational therapy. And a comprehensive faculty guide and PowerPoint slides are provided for each module. The faculty guide contains talking points, case studies, video resources, and activities to enhance student interactivity. And the curriculum was most recently updated in 2019 to reflect current data and evidence-based research. And it also includes additional interactive features to help students engage with the curriculum in new ways. So for example, modules 1, 2, and 3 now have online modules, which allow faculty to present the material in a new format or even allow students to study independent of the classroom. And online modules 2 and 3 are actually broken down into an introductory video as well as 5 shorter videos, which cover specific topics. So this allows the user to tailor their learning experience even more, especially if time is a challenge. And it also presents the content in new ways to students and can be used both during class and outside of class time. So each module contains discussion questions, learning activities, and sample test questions specific to the content within each module. But we've also added a new resource titled Additional Learning Activities, which was created to encourage more student interaction and engagement with the curriculum. And this resource can be found in the master document and provides examples of creative approaches to engaging with the curriculum, and again, can be used across all modules. So the activities within this document fall into 4 categories. The first category is called the reverse classroom approach, which involves students taking an active role in teaching the curriculum to each other. And one activity in this section is called the mini curriculum, which allows students to act as professor for the day and teach a module or part of a module to the class. So students are challenged to present the curriculum in a way that would be interesting or new to their peers. So hopefully this activity can provide even more insight into how your students best learn. And the second category is called Learning Lab, which asks students to, or with working together to innovatively solve an issue or a public health challenge. One of the activities provides visual images and key takeaways on how communities can be dementia friendly, then ask students to draw their own community and identify ways in which their community is dementia friendly and ways that it could improve. The third category is called guest speakers, and you guessed it, it provides a list of example speakers so students can learn from the experiences of people who have been affected by Alzheimer's and other dementias, or who work in a related field and can provide their unique perspective. And the final category is titled Test Your Knowledge, and it provides a link to the Alzheimer's disease knowledge scale so you can assess your students' knowledge about Alzheimer's disease. And with that, I'm going to pass it back over to Molly.
All right, thank you so much, Taylor. And so we are about to be zoomed into breakout rooms. We're going to have 2 breakout rooms based on, you'll be auto-assigned based on your registration. And Taylor with Kaylee will be leading one with graduate public health and related disciplines. I'll be leading a breakout group with undergraduate public health. So when you get into your breakout rooms, please remember to unmute yourself and turn on your camera, and that will help us with those connections and support the dialogue. So I think we have everyone just about back. And so wanted to go ahead and move on. Let me see if I can advance the slides. And okay. So thank you so much. We had a great dialogue in my group, some different perspectives and uses of the curriculum. And sorry, little slide preoccupation here. It's not advanced. There we go. Okay. So welcome to Use Chat. And from my group, I wanted to have a couple minutes for everyone for both groups to hear from both groups. And I did neglect in my group to ask for someone to report out and, one or two best ideas, and wondered if somebody would come in and just share a couple things that they learned or thought of.
I think what I enjoyed is a different perspective. So I'm coming at this from a completely different perspective. And then was it Sammy that, is coming at this like from a teaching perspective. So I think when you bring those things together, then it's a great opportunity for people to learn from one another, maybe a little bit of collaboration possibly for people. So I just like hearing things from a different perspective.
Great. Yeah. And I thought that there was, Sammy was talking about some of the kind of the core competencies that from Sammy Davis from Willamette was talking about some of the different core competencies that they try to use in different ways to use curriculum. And then also that community connection. And so yeah, it was a great discussion with the different perspectives and helpful to us too. Taylor and Kaylee, do you have a reporter from your group?
We also forgot to ask for a volunteer. So I'll ask our group if anybody would like to speak up about something that they learned or one of the activities they might be excited to incorporate. And I'll go ahead and speak for our group. But we had a nice discussion of this curriculum is very new to the majority, if not all of the group. So we walked through the activities and discussed how some of them might be implemented in a virtual way. We also got some wonderful feedback on ideas for future content in the curriculum as it continues to be updated and evolves. So I'm thankful for our group for sharing those ideas and thoughts with us.
Great. We got some wonderful ideas too, so that was really helpful. And I'll be working with CDC and especially Emory Centers to build out a piece of the curriculum called additional learning activities. We'll be layering in some of your ideas. We're at the start of a new 5-year award, which gives us a lot of time to kind of think about, prioritize your ideas and further build out the curriculum. We have some really great, interesting ideas I want to actually get started on today. So thank you very much. And if we could go back to your slides, Liz. And I do want to give a big shout out to Erin Williams and Elizabeth Wiest at ASPPH, who've been the backbone for this workshop and have done so much in terms of helping us plan and host it and bring a lot of wonderful ideas and suggestions to this. Before we transition to just close out, are there any final questions or comments? You can either put it in chat, or we're in a small enough group. If you want to just unmute yourself and pop in with a question or comment, love to hear from you. So I'll just pause and see if anyone has any questions or comments at this point.
I would just take a second to say to everybody here that I think it's an absolutely fabulous curriculum, and I'm disappointed that more faculty and more folks who could benefit from knowing about this didn't attend, to be honest. I'm really excited to start using it next fall. I'm not going to be able to pull it. I might use a little bit of it in the spring in an Introduction to Public Health course at the undergraduate level, but I'm hoping to do the whole thing and have some community partner connections. So thank you so much for the work that you've done.
Oh, well, thank you for the plug. And, you know, word of mouth helps a lot in terms of getting it out. And so, you know, that's one thing for each of you to consider when we send the recording link and the slides and the document with any questions, comments afterwards. Feel free to just forward that. And actually, that's the perfect segue to the next slide here. I know sometimes there's a delay. Oh, let me do this. Okay. We're sharing a single set of slides, so thanks for bearing with us while Zoom catches up with the control features. So, oh, there it went a little too fast. So how to get that curriculum, you can get it at our website at alz.org/public-health.curriculum. So that's one place. It's also on the CDC website. And if you want to stay connected or refer others to learn more about the curriculum, get updates, there's there on the right-hand side of the landing page for the curriculum, there's a way to sign up. We encourage you to do that, but please do share. Thank you. I'm going to turn it over to Heidi in a minute for some final words from CDC and a great resource that will actually, it really complements use of the curriculum. But I do want to say a big thank you to ASPPH for hosting this workshop. We've learned a lot. It's been a lot of fun, but you've been incredible hosts. And also thank you to CDC for the support of the curriculum and presenting today, as well as Emory Centers, our wonderful partner on the curriculum. And I'll flip it over to you, Heidi.
Thank you very much. And I want to echo Molly's thank you to everyone who's participated. This is a multi-year effort with multiple revisions, and attention to detail is just extraordinary, and innovation over the last year with developing the more interactive modules has been wonderful. So thank you for that. One of the things that CDC can offer as you go through your classes and your work and your research is that we have a wealth of data resources that you can look at and peruse. And you can find these at our website at cdc.gov/aging. You can also sign up for a newsletter to keep connected with anything new coming out of CDC regarding Alzheimer's disease and other dementias and caregiving. So among the data portal resources, you can develop and download your own content and your own reports. You can also download customizable reports or prefab reports based on certain things. They're state specific, they're special populations specific, and they're both for the subjective cognitive decline and the caregiving modules that BRFSS collects data on. We have state and national infographics in English and Spanish, as well as other topics for both the special populations, African Americans, Asian and Pacific Islanders, Native Americans, and others. So please look at that resource, and if it doesn't quite suit what your needs are, there's a data portal there as well for older adults that you can tweak and download your own. So again, I just want to reiterate, thank you, and appreciate everybody's work today.
Those are excellent, Holly. Liz Weist here at ASPPH. I'd like to extend appreciation to all of our speakers today, our moderator, Molly French, Linda Freed, Heidi Holt, Taylor Kennedy, and Kaylee Jones. Thank you all very much. So this webinar has been recorded. It will be archived on the ASPPH website in the same event page where you registered. It is offering 1 hour in CPH continuing ed credits, the Certified in Public Health credential. The session evaluation will come to you. I hope you have just a minute to take it and let us know 3 questions or so what you think to assist us in continuous quality improvement of our offerings. Upcoming, we have a couple webinars next week with ASPPH Presents. One is Pathways to Public Health from Community Colleges on Tuesday, and then on Wednesday, Discovering Your Authentic Health Career. We also invite you to stay tuned for our virtual annual meeting in 2021, which will run March 23rd to 25th. All are welcome. On behalf of Alzheimer's Association and the Association of Schools and Programs of Public Health, you've been a great audience. You've been small but mighty. We thank you for your time. We wish you the very best with this incredible work that you're doing. The webinar is concluded.